It's a true honor to welcome
Good
you all
afternoon.
today as we come together to mark two significant occasions: World Hand Hygiene Day, as every year we are celebrating Hand Hygiene Day and sensitizing our nurses regarding the significance of hand hygiene. Today is a reminder that patient safety begins with clean hands and that safe quality care is not possible without the compassion, resilience, and expertise of our nurses. To begin with this meaningful event, I am privileged to introduce a leader who has constantly driven innovation and accountability in healthcare, Dr. Shuchin Bajaj, founder and director of Ujala Cygnus Healthcare Services. Sir was the recipient of the British government 2015 Clivening Gurukul Fellowship for Leadership and Excellence Award at King's College, London. Sir, we are eager to hear your thoughts on today's theme and the path forward for infection control and nursing empowerment. Over to you, sir.
Thank you very much for your kind introduction and a very warm greeting to all of our nurses here. It's truly a pleasure to be here with all of you as we kick off the celebrations for the Nurses Week, starting with today's very important seminar on infection prevention and control on this Hand Hygiene Day. And many special thanks to Dr. Usha Prabhakar, our Group Nursing Director, for organizing these very important, enriching, enlightening, and wonderful activities. As we all know, you nurses are the backbone of our healthcare system, not just at Ujala Cygnus but across the world. And at Ujala Cygnus, we don't see you as just caregivers, but you are the guardians of safety, compassion, and dignity for each and every one of our patient who walks through our doors. Your commitment, your skill, your resilience, especially in infection prevention, since we are talking of that today, are what our hospitals are due to, and what makes our hospitals truly safe spaces for healing. So we are deeply grateful to each one of you. And now, as we mark Hand Hygiene Day, it is worth reminding ourselves that hand hygiene is by far the single most effective method to prevent hospital acquired infections. It is a very simple act, but it saves millions of lives every year. We all know that hospital acquired infections remain a major challenge globally, affecting more than 1 in 10 hospitalized patients across the world. But more than half of these infections are preventable just by practicing proper infection control, starting with clean hands. As we all know, WHO has laid out the 5 moments for hand hygiene, which from today onwards, I hope all of us will practice very sincerely and diligently. So, the 5 moments for hand hygiene, we all should remember by heart and do it before touching any patient, after touching any patient, after touching any patient's surroundings, before clean or aseptic procedures, and after exposure to body fluids. I would request all of you to put yourself on mute so that we can all, take the advantage of each other's interactions. Or if the host can put everyone on mute, that would also be good. But going forward, let us remember that all these hand hygiene moments and processes are not just check boxes. They are opportunities to protect lives. We all know this. We all know that we can save half of these patients from infections, but still global compliance remains only around 40 to 50% of hand hygiene. So this is a reminder that we don't just need awareness, because all of us are already aware. We need a culture of safety. And to build this culture, Dr. Usha is driving this. I am really thankful to her, because at Ujala Cygnus, our mission goes beyond delivering healthcare, right? We aim to deliver safe, dignified, and quality care, especially to underserved communities. So, infection control is not a luxury for us, it is truly a lifeline, because we need to drive efficiencies, we need to lower costs, And nothing of this can happen if we have hospital acquired infections, because we all know that if you have an infection, the cost of the treatment rises multifold, the stay of the patient rises multifold. So we need a strong focus on process innovation, and we need to ensure that even in resource constrained environments where we operate in, safety is never compromised. So I believe that as leaders, we all must lead by example. As doctors, administrators, and healthcare professionals, we must model the behavior we expect, starting with clean hands and a clean conscience. So, every infection that we prevent, you must remember, is not just a statistic. It is someone's mother, it is someone's child, it is someone's grandfather who goes home safely. And as I never tire of repeating myself, every patient that you see lying on a bed, you should always imagine that this is your relative, your father, your mother, your brother, your sister. If they were lying in that bed, what would you have done? And you will never go wrong in patient care if you treat each and every patient as your family member. So let us make every moment count. Let us make every hand wash matter, and let us keep hand hygiene as part of our life, part of our culture, and totally imbibe it into ourselves to make sure that we fulfill WHO's all moments, all 5 moments of hand hygiene every time: before touching a patient, after touching a patient, after touching a patient's surrounding, after handling any body fluids, etc. We must make sure that hand hygiene is a part of our routine. Thank you very much for listening patiently. Thank you very much for joining this webinar. And again, many thanks to all the nursing teams for providing us, patient care, patient succor, and all of you have been the totally backbones of our system and will continue to be. And without nursing, there is no hospital, no healthcare. So again, thank you so much for standing with us, for walking with us, and for treating each and every of our patients with the care that you do. Wishing you a very, very happy Nurses Week ahead, and looking forward to all the celebrations culminating on 12th, which we all hope to be a part of.
Thank you so much, sir, for that insightful and powerful message. Truly inspiring, as you had mentioned, that if we are following 5 moments of hand hygiene, we'll be able to prevent infections all across the healthcare. Thank you so much, sir. Next, I have the pleasure of inviting Dr. Mohita Chandra, Group Medical Director, to deliver the welcome address. Ma'am has consistently led from the front, driving clinical excellence while ensuring quality and compassion care across the board. Ma'am, with nearly 3 decades of experience in healthcare delivery and multiple awards to her name, is sure to help transform our clinical framework, outcome, quality, and capability building academic programs. Ma'am is the awardee of Times Healthcare Leadership and various other awards in the field of healthcare, with over 27 years of experience in healthcare leadership. Over to you, ma'am.
Thank you, Deepika. Good morning, all the nurses. It's such a pleasure to be here and to be talking to you on this important day. Today, we have gathered to honor the most dedicated, compassionate workforce, which is our nurses. Dr. Shuchin has said that you are the backbone of the healthcare. I totally agree, but I would also say that you are the heartbeat of healthcare. You know, the healthcare is nothing without nurses. You're the first responder. You respond, immediately, and you're the last to leave. And thank you for doing what you're doing. You're the quiet strength among all the madness that happens in the hospital. And you're also like an oxygen who's always available in OPD, IPD, OT, taking care of patients. And if required, there are times when there is a patient who's in fear, you hold their hands like a mother. And there are times when you deliver your complex care with resilience and compatibility. Thank you very much for giving us all these. I also want to recognize, I also recognize that this is not just a job. Nursing is a calling. It's a calling for compassionate care, and it's a calling for resilience. So today on Nurses Day, I just don't want to say thank you. We are here to celebrate nursing. We're here to celebrate nursing not in this just whole 1 week, but entire year. Thank you very much for being the superheroes that you are in Scrubs, and who makes the world much better place for all of us to be in. Thank you, and a very, very happy Nurses Day to all. Thank you, Dr. Usha, for organizing this wonderful activities and bringing out important topics. Dr. Shuchin has said a lot about infection control. Let us just take things forward and do the infection control and hand hygiene practices in letter and spirit, so that we are able to get the best outcomes for all of us. Thank you, and a very, very happy Nurses Day to all of you.
Thank you so much, ma'am. Your words really resonate deeply with the today's theme. Thanks a lot, ma'am.
Thank you.
As we are moving forward to our expert session on hospital infection and control practices, focusing on World Hand Hygiene Day, it's a privilege to welcome Dr. Usha Prabhakar, a renowned leader in infection prevention and hospital epidemiology. Ma'am is highly qualified, eminent leader in nursing. After completing her BSc and MSc in nursing, she did her doctorate in nursing and many more qualifications. Ma'am is the recipient of Dr. B.R. Ambedkar Excellency Award in 2022 and also a certified assessor for NABH, QCI and QAI. Today, she will take us through practical and updated HIC policies and protocols that are essential in ensuring patient and staff safety as well. Please welcome Dr. Usha Prabhakar to begin with the session.
Thank you so much, Deepika, for warm introduction. I would like to thank, you can disconnect the slide so that I can initiate the slideshow, Deepika. Yeah, thank you for setting a right tone as we are celebrating a World Hand Hygiene Day. Many thanks to our founder director of Ujala Cygnus Healthcare, Dr. Shuchin Bajaj, and also would like to thank Dr. Mohita Chandra, our group medical director, for encouraging and recognizing the dedication, passion, and the empathetic approach which we do while delivering the healthcare services across IPD, OPD, OT, across entire healthcare vertical. It's a 24/7 work which tirelessly each nurse put in efforts to provide a culture of safety, which Dr. Bajaj mentioned. That culture of safety signifies a very, very important and crucial role while any patient comes to healthcare to avail the healthcare services. They need a safe environment, which includes infection prevention and control practices, well-versed hospital, and also the nurses who are empowered to practice good practices, which we call as a gold standard practices. Yeah. So thank you so much. And as we are celebrating today's World Hand Hygiene Day, every year, 5th of May, we celebrate this hand hygiene day to sensitize and bring the significance of single and at most effective when it comes to the infection prevention practices in across healthcare is the hand hygiene. The 5 moments Dr. Shuchin had mentioned very clearly that if you practice this, you will conquer the prevention of cross-contamination and prevention of infections, which are a very high in leading factor, contributing factor in increasing mortality rates in hospital. This year, International Nurses Day, we celebrate from 6th to 12th, and the 12th is being the remembrance of Florence Nightingale's birth anniversary. We do on 12th of May, International Nurses Day, and every year we do have a theme. And this year theme is Our Nurses, Our Future, and caring for nurses strengthens the economies. That means that if we care for our nurses' empowerment in terms of a knowledge series, providing right equipment, work-life balance, looking after them, providing a environment which is competent and confident environment to deliver the top-notch skills based on policies, processes, and gold standards, the care pathways which we provide, and empower nurses to practice while not waiting for doctors to come in case of emergency situations, and start away interacting and delivering like basic life support, ACLS, and NALS and PALS. Every nurse are empowered to initiate the steps in order to save the lives. So today's topic is infection prevention and control, and what is the significance of nurses' role in this. As you can see, it is a hand which has got a lot of gems, and if you can break the chain, which is depicting on second one, you will stop infections spreading across in healthcare vertical by only and single most effective method is clean your hands. That is, clean hands can stop this and break the chain of infections. How do you break the chain of infections? As we all know, there are different ways how these will spread from a host susceptible host to an infected person who is a reservoir, we call it as. So the agent, it goes to a reservoir, and from the port of exit, it can be a various ways. It can be a mosquito if it is in dengue, if the infected person mosquito bite and it enter into the mosquito, and from there it gets infected and then gets getting into a mosquito bite to a susceptible host, and then that host is also getting into infected. In case of any other MRSA, or that is like a contact precautions, if you can able to, if it is a pulmonary cox, if you will wear a standard precautions, respirator mask, then you can prevent a droplet infection. So there are different ways of eco-oral route in case of any E. coli, any cholera outbreak. So single most again is hand hygiene and personal protective equipment. If you wear it, then you will break the chain of infectious agent to a reservoir and reservoir to a susceptible host, and that's how you can prevent the cross contaminations and HAI rate, which is a significant reason, as I said, increasing contributing factor for the mortality apart from a disease condition. Whose responsibility is when it comes to the healthcare? Hospital infection prevention, do you think it's only a doctor's and nurses' responsibility? No, it is not. It's everyone's responsibility when it comes to it. So the person who is providing physiotherapy right and left to a radiology diagnostic, lab person, even to the patient care coordinator, housekeeping, maintenance, ambulance crew, whoever is in contact with the patient and patient surroundings, or the patient carrying equipments, even to the beds and floor and environment, each and every person are responsible to prevent it. And then it's everyone's responsibility to wash hands and maintain the clean environment. What should you know about this infection prevention before even we go ahead with this infection prevention? As I said, it's everybody's business when it comes to the healthcare, and there are different ways you can prevent or break the chain. That is, one is hand hygiene, but not only hand hygiene, there are respiratory hygiene, cough etiquettes. We have seen in COVID pandemic, everybody were wearing masks. The droplets we need to be prevent when it comes to tuberculosis, anything, work restrictions. So this, if someone is suffering with the chicken pox, you restrict yourself and isolate. If someone is having a diarrhea, you restrict yourself. If someone has got a dengue, you stay at home, so that we will prevent the chain of breaking that chain. Standard and transmission based precautions are the most effective ones. So proper personal protective equipment, if you wear it, if you isolate a patient, the MRSA, which is very, very dangerous, you can have a contact precautions, then you can prevent it. So all the standard and the transmission based precautions every person in healthcare should know, on the most, each and every nurse working in hospitals must be aware about it. Waste management is also very important. How do you handle the infected soiled waste, and also how do you segregate, how do you discard at the point of generation at the bedside itself, including the sharp safety, which is very, very important in order to prevent it. And employee health, as we empower nurses, everybody should know the employee health. Your preventing steps are there, vaccinate, flu vaccines are there, hepatitis vaccines are there, vaccinate yourself. If it is anything, you cohort yourself early, recognize it and seek help, and that is all. So what is the mode of transmission? As we are mentioning, 80% of the infectious diseases are transmitted by touch, and hence that's what Dr. Bajaj also mentioned. 80% of this is in our hand. You can thoroughly wash your hands, use the hand rub, maintain the 5 movement, be aware about it, religiously practice, and then you can prevent this transmission. So why infection control? Everybody knows, everybody, is it effective? What we are talking about, effective hand hygiene is most important. 1 in 3 of us are carrying the bacteria that can kill. So infections, you are not supposed to be pass it on this infection, you are supposed to be preventing. So every 2 minutes someone gets infected while they are getting the hospital services through the HAI of different 40 CLAPSI, which we will be discussing further. So you can be a person who can prevent it. As we can see that there are a lot of hidden germs in our hands. So wash it, prevent it, protect it. It's a simple WHO tagline. You thoroughly wash, hence you can prevent it, and you can protect not only patients but their beloved ones and you yourself also while working it. International patient safety goals, all of us we know, and the 5th goal very, very significantly play a major role in order to prevent this HAIs is a single and effective most method is the hand washing. These are the 5 movements already Dr. Bajaj has mentioned regarding. So before touching a patient, before doing any clean aseptic procedures, after touching a patient, you always remember that when you enter into the patient room and when you are exiting from the patient room, both the times you have to use a thorough hand rub and aseptic techniques. If you are doing any surgical procedures, or when it required a proper hand washing, you don't compromise washing your hands. And blood and body fluids are very important. Most of the time we see the housekeeping staff and the nurses don't wash their hands or use the hand rub and don't maintain the 5 movements. So play a significant role. And audits, another one which infection control nurse does, and the senior nurses and in charges of each department must have a culture of safety, inculcate into a day-to-day practice that audits are very important. Empower the nurses, and you can be empowered to stop even to the top surgeon if they are not maintaining the 5 movements of hand hygiene. This is while I was working in NHS UK. This is very important, and I thought that I will share it with each one of you, all the nurses who are taken time to empower yourself and participating of this webinar today. Do you know where the elbow? This is a very important. We do check each nurse one to other while we entered into the shift. And so we check that if it is anything below the elbow, we need ask each other to hold it up and then bear below the elbow to prevent the infections. So you have to roll up if it is a scrubs are long or your uniform. No stone rings, no nail polish, and no artificial or the fancifying jewelries, including the wrist watch when it comes to the healthcare premises. So discourage, check, and encourage each other to practice a good bare below elbow practices. And when it comes to the hospital, biomedical waste segregation, unanimously, though there is a state pollution control guidelines, but you all should be knowing about red and yellow are unanimously across country is the same. So infected waste, infected plastic, and infected non-plastic is a simple way to remember, simple way to teach, simple way to audit in healthcare. And biohazard symbol is there, proper segregation at the point of generation prevent the 80% of the infections. And the sharp safety is most important. The standard precautions which I was talking about is these are the standard precautions while we are in healthcare we need to practice. Hand hygiene is the again most effective. Apart from that, biomedical waste management, wearing appropriate PPE when it comes. Why I'm saying it is isolation, every nurse should know that is it a droplet, is it a contact, is it a orophycal, what is the disease condition of the patient and what is the transmitting method. And you can prevent it by providing a negative pressure, positive pressure, different kind of isolations it is required, different kind of a personal protective equipment is required. So you need to aware about it and accordingly use the standard precautions to prevent it. Sharp management is very important to prevent the SCV transmission. So from the susceptible to a host to a susceptible. So blood and body fluids while handling it or using the sharps, you have to have a point of generation itself, the sharp safety management, linen management, environment cleaning. For the slides, we'll talk about safe injection practice. It's a single and most effective. Everybody should know that one syringe, one needle, one time only to be used, no reuse. It's straight away going into a bins. Safe injection practices and cuff etiquettes, which we don't see widely in some of the healthcare organizations, which we need to practice. This is very important, and thanks to COVID, that it has played a very significant role in sensitizing the entire community as well. We always believe that lumbar puncture procedure is a surgical procedure where doctor is wearing a normal mask and doing aseptic technique procedure, but discourage, get empowered and ask them to wear a surgical mask instead of a simple mask. These all are the PPEs which everybody should use. Appropriate usage of is the key to the success. So you have to know and then accordingly use it. Donning and doffing is a part of it. Hand hygiene is the most important before even wearing the appropriate PPEs. Now, to the topic before going to the bundle care, the HAIs, we all know if a patient admitted to the hospital and after 48 hours of admission, if patient will have a presence of certain symptoms which you think that is a part of classification under the HAI, then you have to further investigate and confirm it that is it a HAI. So for that, everybody should be aware about it. And healthcare associated infections are the leading causing factor, which leads to 30% of it to the mortality. So effective infection prevention and control reduces the HAI by at least 30%. So 80% by your hand hygiene, 30% by using proper techniques, you will be able to reduce and provide a very, very effective and safe culture of safety environment to the patients. And most common HAIs, every nurse, every person, healthcare person should be aware about it. It's a urinary tract related, respiratory tract related, bloodstream related, and wound infections. So these are the four. I will quickly signify what is that. You must be knowing about the infectious agents. क्या है वो? So bacteria, fungi, viruses, and certain pathogens, E. coli also play a major role. So you must be aware about what kind of a infectious agent the patient is having. And one of the studies shows that there is a huge percentage of CLABSI, VAP, 40, and if you are aware about it, if you have a checklist, you know the bundle care, you will use the appropriate hand hygiene along with aseptic techniques, you will prevent this HAI. So we all are empowering Ujala Cygnus nurses and the entire team of nursing fraternity who are joined this. Please be aware and practice the good practices. Ventilator associated pneumonia, and now we don't call it as a central line associated CRBSI. We are classifying as a CRBSI, is a catheter related bloodstream infections. COTI, catheter-associated urinary tract infection, and SSI. So quickly going through it, the bundle care, which nurses are the key persons, they are the backbone and heartbeat, as Dr. Mohita mentioned. So let's get empowered and practice good. Comes to the ventilator-associated pneumonia, first is foremost is the hand washing before touching and all the 5 movements, but the head and elevation in all critical care areas, you make sure that 15 degrees to 30 degrees, no patient should be any reason, even you are providing a bed bath or any care, you make sure that patient is never been put onto a flat position. Elevate a minimum of 15 to 30 degrees of head elevation will prevent the pneumonias. Oral care, very good oral care is important if a patient is intubated, and use the closed sections rather than open section. If you are using the open section suction catheter and the saline bottle, then label the saline bottle, use the sterile saline, sterile aseptic technique. Everybody should know, wear gloves after washing hands and do the suction and change the suction catheter if you think that catheter is visibly dirty, and once in 24 hours it's been moved away. Now once in shift you need to change the suction catheter if you are using the open suction. That is why we are always encouraging closed suction, so that there is a less chances of contamination and you can provide the aseptic technique. PUD prophylaxis is the peptic ulcer disease, so you must know about what is that you are putting on a patient on feed. If it is a feed, then it's okay, nasogastric feed. If it is not and the patient is on empty stomach, you need to look, you can ask, you yourself are empowered, all the critical care nurses are, take it, you are empowered, your knowledge is a weapon. Go back and ask doctors if they have forgotten to prescribe. You can get it prescribed and provide pantoprazole or one of the PUD prophylaxis if a patient is on NBM. DVT prophylaxis if the patient is not having active passive exercises. And if it is indicated, DVT prophylaxis on a bedridden, bedbound patients is the most important to prevent the clots. And sedation vacation is the nurse-led. And while I was working in UK, we are the one we used to. Sedation vacation is the one important key responsibility of the critical care nurse, to time stop, hold it and see the response and GCS and inform to the doctors. Early extubation, always aim for it so that the ventilator associated pneumonia can be prevented. And other than that, while delivering the care, we always wash our hands. And you all must be knowing about not only the 5 movements but hand hygiene, washing steps, both surgical and medical hand washing, and use appropriate time. Don't be in rush, don't compromise for washing your hands. Elevation, PPE, oral care, but manometers are some of the places which we don't see. Even if it is available, the manometer to check the cuff pressure of the ET tube and tracheostomy tube, nurses don't monitor, not having a habit of documenting it. Why do you? If you don't know the significance, then only you will not be using it. If you know the significance, that if the tube is leaking, then the secretions will go and there will be a chances of aspiration pneumonia and lead to a ventilator associated pneumonia. So you have to have a proper cuff pressure manometer to be used to monitor the cuff pressure. And filters, I've seen some of the places the filters don't label it. If you don't label, then how do you know that filter got changed or not once in 24 hours? It is very important. And humidifier for the ventilators, the water have to be sterile. It cannot be a tap water, closed suction. So encourage all of them in order to prevent the ventilator associated pneumonias. Now the second one is very important, as I was mentioning, catheter related bloodstream infections. We call it as a CRBSI rather than CLBSI, but both are okay as long as you know the bundle care and the preventive steps. So one again is the hand washing and all the 5 movements, as we are signifying today. Maximum barrier precautions while inserting, so complete absolute sterile PPEs, hand washing, skin preparation, which sometimes is also a contributing factor if you don't clean it before inserting the central line or any catheters. So chlorhexidine skin preparation, allow it to dry, which is also a compromise. Some of the time we all are in rush. Ask, you are empowered, allow it to dry, wait, ask, sensitize the doctors also. And chlorhexidine skin preparation is very important. Then after the procedure, while doing the intra procedure, the call for the infection control nurse to do the audit, and so that insertion time itself, if there is any breach, you all will be knowing it. Good audits always encourage. And catheter care, daily monitoring, seeing the VIP chart, early recognition of if there is any symptoms, redness, pus, oozing, any symptoms. If you think so, sensitize, escalate, and get it changed before even it reaches to the complete septicemia. So early removal is also encouraged if it is not indicated. If all the infusions are not being used and you think that there is no need of central line to be in place, you can take empowered and discuss in the daily rounds and ask them to remove it. Or before shifting from the ICUs, I've seen, we usually see in the ward also, so you can ask and get it removed before shifting out. So all these are good practices, nurse-led practices. The empowerment is very, very important on this International Nurses Week sensitization. Insertion bundle, as I was saying, insertion bundle audit is the very, very effective. We have seen it to reduce this CRBSI rate. And the skin preparation, right product which contains chlorhexidine is important rather than simply cleaning it. And transparent dressings. Maintenance bundle, scrub the hub is a very good practice. Every shift, every time you use the central line, you scrub the hub practice, clean it and use it. Second one is the line should be labeled with the date and time. Nowadays it is the NABH, very important objective element, that whether your lines are being segregated and also labeled or not. Infusion pump labels, the transparent dressings, scrub the hub practice. And again, anything and everything if you do it, but if you don't do a hand hygiene practice, and if you are not having a awareness regarding the safe injection practice, then there is no way you will be able to prevent the CRBSI. The third care bundle, which is very, very important, is the catheter associated urinary tract infections. So, and most of the time the urinary catheters are being inserted and empowered to insert by nurses across hospital, mainly from emergency department to a operation theatre to a critical care areas. So wash your hands thoroughly, proper hand hygiene, washing your hands where below the elbow. Remember that antiseptic, so aseptic precautions, it's a sterile procedure. Securing the catheter is sometimes we see that it gets compromised. So properly choose how to secure on the side of the tie. Euro bags are always been seen that it's lying on the floor. You properly, tie it up edge of the bed. Closed drainage system, encourage, monitor intake output, and review daily for early symptoms of catheter associated infections. If there is any cloudy urine, if you think that it is not transparent, if it is smelling, patient is complaining of pain, you think that while emptying it is giving a foul smell, early symptoms all can be recognized and remove the catheter and replace it, send the urine cultures. These all are the good practices which are mainly done by the nurses, so you get empowered and do it. Early removal is always encouraged. Insertion bundle is something, again I'm saying it, all the audits which play a crucial role. So while inserting itself, someone can do the audit for seeing that whether the aseptic technique has been maintained, proper hand hygiene is there, 5 moments, everybody is aware about it, and securing. And bulb inflation is also very, very important. Sometimes we have seen the urethral rupture if the person is not competent enough, and if there is enough ballooning is not been done, and then it is a leaking of the urine, also will have a backlog and causing to the urinary tract infections. So knowledge is the weapon. Nurses should be confident and empower, and then insertion bundle, daily checklist, every shift, handovers, and maintaining and early recognition of the urinary tract infections and sending the cultures, sensitizing, escalating to the doctors will prevent a HAI contributing of, remember that 30% of the mortality rates of leading to, you can reduce it if you are aware and empowered. So this is how you will be able to secure the catheter so that there is no traction and there is no pull out and there is no, not only the rupture or the trauma, but also the urine leakage led to a body can be prevented. Properly secure and the edge of the bed. Don't let the urine bag lying on the floor and contaminating through the floor. And encourage housekeeping team to teach them and secure it and close it. While shifting from one department to other department, I have seen the urine bags are just left open between the legs and the urine is getting back into it. So you should have a habit of emptying the urine bag, take it into intake output, and then shift the patient from one department to other department. Quickly moving on to the surgical site infection SSIs as a part of the HAI, very important, and again empowered by the nurses. So infection tracker which we maintain SSI not only by the ICNs but entire OT team and ward and everywhere, post-operative, pre-operative, every person in healthcare should be empowered to know about how to prevent SSI. It is not only the surgeon's responsibility. So how do you need to track it every surgical patient for 30 days and any implant patient for 90 days after the surgery, as you know it. So SSI prevention bundle, as you can see it on the right side. Deepika, just correct me. Am I okay with the timing? And am I going very fast? Is it understandable, audible?
Yes, ma'am. Yes, ma'am. Audible, understandable, ma'am.
Okay, thank you so much. And bear with me, it's only another 5 minutes. We are reaching to the fourth care bundle, which is very important, SSI. So you can see the operation theater, a typical picture depicting that we think that once in a shift, cleaning in the morning or in the evening is enough. It doesn't. In between the patients, one case to other case, we usually have a half an hour time to clean in between. And when it is cleaning, when it comes, the housekeeping team and other OT team thinks that it's only a floor cleaning and emptying the bins are enough, but it is not. It have to be a OT table in and out, lift up, anesthesia machine, monitors, lights, everything including the IV stand also need to be cleaned. So floor, ceilings, theater table in between the patient, walls, check, clean daily and dust free and washing properly. Drip stands needs to be cleaned thoroughly, and medical gas equipment area also need to be. Some of them are very scared to touch and they think that their anesthetist will get angry or upset. It is not. You need to empower, educate and audit and see the practices. That's how the HAI prevention will happen. And don't leave only on the ICNs. It's each and every person's responsibility. SSI prevention bundle, the 7S bundle are very important. So very first is the safety, safe operation room. So doors also all important while doing the procedure. The doors needs to be get closed. Don't open the door unnecessarily. Number 2 is screen. So screening for risk factors and the presence of MRSA and so viral markers. Anyway, we will be doing it. Apart from that, this is also important. Screen it. And then showering is very important. This is done by mainly looking after by the nursing team. So we need to encourage, audit, ask, and make sure that patients going to a theater are taken enough properly a shower, and a bedridden patients needs to be taken care by the nurses itself. So chlorhexidine shower is very important rather than just a soap. And skin preparation in the theater is very important. Skin preparation with the alcohol based antiseptics such as anything. Along with that, we know it that it's iodine based. We clean it before even giving the incision. That is very important. How much time you are doing it for preparing the skin inside the theater is also contributing to the SSI. And also the surgical irrigation before closing. The surgeons mainly irrigate it before to the closure, and to remove the exogenous contaminants by using properly a saline, warm saline or any antibiotic irrigations. That is also prevents the SSI, and that is a way, obviously it's a surgeon's choice, but it has to be a in part of the procedure. And also the sutures which you are using, it suture closure is very very important. What it is been, the material of the suture is coated with the antimicrobial product, then it will prevent the skin contaminations. And the skin closure with the after suturing it, cleaning it and then applying a dressing is also very important when it comes to the SSI prevention. Skin adhesive to seal the incision, which is usually the dressing material is antimicrobial dressing to prevent the exogenous contamination in post-op period. So these 7S bundle are very important, and if you can able to do it, it plays a significant role. We at Ujala Cygnus, we have a different care bundles. This is just an example of our daily, every patient having a catheter and other things which are discussed on ventilator. We do this daily monitoring on morning, evening, night shift, and early recognition and informing. Every hospital should have a infection prevention control committee. This committee, I thought that it is a best day as we are empowering and strengthening, and as our International Nurses Day theme is also to uh, empower our nurses, strengthen, then it will help. So the HIC committee will be, every hospital might be having it. There will be an infection control officer, mainly a microbiologist or infectious disease prevention qualified person. Along with that, there is an infection control nurse playing a major role, and there will be a link nurses in each and every department of all the departments of the hospital. In each shift, there should be one link nurse to do different kind of audits, which I said that insertion time itself, if we can able to have a good practices, gold standard practices, good skills, then you will prevent 30% of your HAIs on daily monitoring and early recognition. So WHO guidelines, you can visit WHO website to see that how do you formulate if you don't have a committee. And committee, every member should discuss all this month on month tracker and do the root cause analysis, have a fishbone technique to know that is it a people related, processes related, is it a technology related in terms of any equipments, is there any knowledge deviations, and identify it and fix it, and do your surveillances and monitor it and report it. And then again, it's a cycle of the audit cycle. So you identify, then you discuss, you implement, you change the process, and then re-audit again. So this is how the HICC committee will have established IPC program. There will be a budgets, then infection control and prevention programs are there under planner. Usually medical director also oversee it, and then we do a series of activities. We monitor month on quarterly basis such as the committee meeting, and delegate the responsibility and closures and implementation, which I was talking about the audit cycle. To summarize my presentation, the 7 strategies to prevent a healthcare associated infections, HAIs: hand hygiene, environmental hygiene, screening and cohorting the patient. If you think that patient is MRSA positive, how do you cohort? If you think that tuberculosis positive patient, how do you cohort? If it is a dengue patient, if it is a COVID positive patient, where do you keep it? Is the most important questions, and every nurse should be knowing it. If you think there is a outbreak of cholera, how do you, or a patient E. coli? So these are the things you must be knowing it, and choose in ICU any one corner of the bed, dedicated nurse, provide aseptic techniques and do the proper hand hygiene and scrub the hub techniques. So have a quality improvement programs time to time. If you have any kind of a outbreaks, surveillance is the majorly ICM play a crucial role. Monthly surveillance, weekly surveillance, and discuss antibiotic stewardship. Microbiologist and clinical pharmacist and all the clinicians play a major role in sensitizing it, and early the sepsis pathway if you have, and all of you know antibiotic as a prophylactic antibiotic has been started. After that, cultures, based on the cultures, de-escalation is a very important. Collect the culture sample, inform to the clinician, make sure that right kind of antibiotic get it. De-escalation, if you think that antibiotic day 1 2 3 4, you are the right person. Every nurse is empowered to go back and discuss that, doctor, it is going on for last 5 days 7 days, high-end antibiotic, you can challenge, you can empower, you can find out, you can sensitize. Everything is possible only if you have knowledge. So antibiotic stewardship is everybody's responsibility, not only the doctors. Following guidelines are the most important, and that's how the safety culture, it's an overall safety culture which we are talking about. And so if you create that environment, you will feel. Takeaway points quickly: OT table can be cleaned with a bacillol, all equipments, monitors, cardiac table, bacillol spray or hydrogen peroxide, oxivir, whatever is your hospital policy. I thought that I will just give you some of them, or if you are not aware, you should make it out of this webinar. Floor cleaning again is a bachelor's solution, 1:10. Usually your housekeeping team supervisors must be aware about it under your supervision. And ICUs and NICU, PICUs and OTs, it have to be observed and supervised by the in-charge nurses. Cleaning of wall and ceiling in critical areas, again a bachelor's solution. Weekend cleaning is most important with the same solution. Suction jar cleaning is clean immediately in emergency department and ICUs. We see that patient is sitting for 1 month. You don't have to keep it the same jar for 1 month. So suction jar cleaning is clean immediately after every usage, especially in emergency department. Clean and then clean with the water, then dip it into 1% of sodium hypochlorite solution for 20 to 30 minutes, dry it up and reuse it. So you need to have a spare suction jars also, and please make sure that weekend cleaning happens. There will be a register and there will be a process of weekend cleaning of all the areas. Skin preparation is very important. As I said, most of the areas microshield might be using it, betadine followed by microshield, or some of the places you might be having a chlorhexidine, depending on what type of a catheter. Oral care is very important, using the oral swab, and only except the newborns, rest all areas chlorhexidine will be used. Only at the newborn we use simple saline, sterile saline. Critical items, semi-critical items, non-critical items, they are the three things when it comes to the hospital, and every person should know what is the criteria or what are the equipments you are handling it. If you know that it is a critical item, how to clean and disinfect. If it is a critical items, what is that classification? Is items entering into your body or any vascular system, surgeries mainly. All the equipments have to be steam under pressure, is called sterilization, ETO or dry heat. If it is a semi-critical items which are in contact with the mucosa or non-intact skin, especially your laryngoscope, sambo bag, all these things, the scopes. So disinfect by a high level disinfectant, mainly the solution, have to be a glycerol dehyde 2%. Non-critical items which usually in contact with the intact skin. So come in contact with the intact skin means there is a skin barrier. So it is only touching the skin, not interacting with the mucosa or inside. So that is called as a non-critical items, such as BP cup, bedpan, bed rails, or any of the crutches or any of the bed and nearby bed equipments that can be cleaned with the bacillol spray once in shift. Ambo bag, you just wash and clean with the soap and water and send for AHU or a plasma sterilization. Laryngoscope, just after usage, wash and clean with the soap and water. Clean with the 70% alcohol. Swab or bacillol spray is okay. 70% alcohol is okay to clean it and keep it again. we say it as it's a clean procedure. You need not to be sending anything for laryngoscope based on the recent guidelines. Ventilator circuit, usually we say it's a single use, and HEPA filters, you label it, and if it is visibly moist, you may have to change it. Otherwise, once in 24 hours, label it and change it. And bronchoscope and endoscopes are very important, and it's a high-end disinfectant, and cleaning is very important. Recent guidelines talk about hydrogen peroxide based solutions only to be used. Chlorhexidine alone is not enough. So clean under the running water on the scopes, dip it into an enzymatic solution based on your hospital policy for 10 to 20 minutes, and then later on brush it, dip it into a disinfectant solution for good 20 minutes, and clean it with the sterile saline and use it as a sterile for next procedure. Usually we use these bronchoscopes and endoscopes in your daycare center in terms of a endoscopy department. So every nurse, every technician should be empowered to clean it. Very important that all ICUs, you must be knowing AHU criteria. Don't leave it on a maintenance person to come and check the AHU. AHU, you all might be knowing. If you don't know, it is a full form is air handling unit. So most of the infections, outbreaks which we have seen it is good practices are there, good hand hygiene is there, cleaning is there, still there is an outbreak. So mainly AHU. That is why I thought that I will include into my slide. Air handling unit is very, very important. At least the temperature needs to be maintained between 22 to 26, all your critical areas, with the humidity of 45 to 50 degrees. So that is why we are asking to monitor through the checklist the humidity and temperature. And air exchange obviously might not be empowered by the nurses, but maintenance people, biomedical engineers, everybody should be aware about 8 to 12 air exchanges per hour should be a setup which we have to do it in AHU, and 2 to 4 are the out of that are the fresh air. Rest can be recirculating air. So these all are the contributing factors of the HAI. At least you should know when you are doing your RCA kappa by ICM and in charge nurses and senior nurses, including the nursing superintendent. I am showing you the pic on the right side that cleaning means it is not only floor cleaning, it is on the up to the ceiling. 4 to 5 feet height ceiling is cleaning is very important of the critical care areas. So cleaning, only monitor and equipment and floor cleaning will not suffice. So have a good practices. Weekend cleaning is very important. If you are pasting any of the informations on the walls, it have to be into the laminated version so that the cleaning can be happen on top of it. Encourage housekeeping team, empower housekeeping team. Also positive pressure, negative pressure, you need to know that what is the negative pressure. 2 to 4 pascals you have to maintain to have an effective negative pressure. And immunocompromised patients where you use HEPA filters and air exchange, and positive pressure ventilator, positive pressure isolation rooms, then again you must know what is this air exchange significance. So on summarizing my slide, today we have discussed on various methods of preventing, identifying, early recognizing of HAIs, and we have played significantly again and again, emphasizing on how important is a single most effective method, which is hand hygiene. So, and some of the challenges and some of the care bundles. So with this, thank you so much for giving me an opportunity to discuss, and also on this International Nurses Day Week celebration from Ujala Cygnus Healthcare. It is a privilege, honor to discuss to the entire nursing fraternity regarding this. Thank you ever so much, Deepika, for giving this opportunity. Over to you.
Thank you so much, ma'am, for such an enlightening webinar. The session was very informative and thought-provoking. The critical insight you had shared will undoubtedly enhance our understanding, and surely everyone is going to be applying these practices all across the healthcare. As we come to the close of this insightful webinar, I would like to leave you with one final thought. Let us continue to lead with clean hands and caring hearts. upholding the highest standard of infection prevention and control practices so we'll able to promote patient safety. Protect patient, protect yourself, and practice infection control practices. Thank you so much thank you so much everyone for your time, energy, and unwavering commitment to delivering safe, highest quality care. Your active participation and dedication are truly commendable. As a part of Ujala Cygnus Healthcare Services, we are having ongoing initiative to empower our nursing professional. We are proud to present a series of knowledge webinar under the visionary leadership of Dr. Shuchin Bajaj sir and Dr. Usha Prabhakar ma'am. These sessions aims to strengthen clinical knowledge and promote best practices in patient care. We sincerely thank you for your active participation so far and encourage you to stay tuned for tomorrow webinars too. Thank you everyone and
Here's the
wishing you
topic.
all a safe and inspiring International Nurses Week.